Hi, Dr. Elisha Van Dusen here with New Hope Chiropractic. What's torticollis? Well, the Latin term tortus means twisted and collum means neck, so hence the name torticollis. The common name for this condition that you might hear most of the time is wry neck, and that's a dystonic condition defined by an abnormal asymmetric position of the head and neck. So basically it's an unusual position of the neck where it's not symmetrical, it's twisted over to one side and it just doesn't look balanced. And congenital torticollis is the most common form of this condition. And by congenital, I mean it's present at birth. And the cause is unclear, but it's most likely the result of some kind of trauma during birth, or also faulty positioning in the uterus before delivery. And in a typical presentation of this torticollis, damage to the sternocleidomastoid SCM muscle that attaches between the sternum right here and the breastbone and the clavicle right here, which is your collarbone, and the mastoid process behind the ear here, causes the head to extend back like that and sideways, and it rotates to the opposite side. So it's a highly unusual position for the neck to be in. Very, very uncomfortable, as you might imagine. Congenital torticollis is diagnosed in the first 1 to 4 weeks of age, and sometimes you can even have a firm mass in that SCM muscle. You can see that on an ultrasound or even felt by hand. It's like a nodule. Treatment can start right away, chiropractic treatment especially. It usually includes some adjustments like stretching too, chiropractic adjustments, stretching of the muscle, mobilization of the neck, moving it around, increasing range of motion, and like I said, gently adjusting the neck. Also, you can have manual traction and electrostimulation and ultrasound. All these things are found to be helpful as well. But the most important thing is the chiropractic adjustment. And the treatment of this condition, often teaching and instructions for the patients and the parents especially. The kids are really, really young, obviously, on how to stretch the muscle and how to position the baby to reduce this altered posture is also very important too. You can also add neck supports to a car seat, use toys, lights, or sounds to encourage kids to look in the corrective direction, placing the baby in the crib with the affected side by the wall so that they have to turn to the non-affected side to face out and see stuff around them, and also lie down prone, that's the stomach first, with the affected side down. All these things will put the baby in the proper position, away from the torticollis position. In very, very rare cases, about 5 to 10% of the cases may actually need surgery to release the muscle, but that's very, very rare. Great news is that the vast majority of these cases of congenital torticollis resolve with conservative chiropractic care, and it's very, very effective for eliminating this condition. So if you have a baby or a child that has this, this type of torticollis, it's best to take them to a chiropractor as soon as possible. So you can check us out at newhopechiropractic.com for more information and also to book an appointment. And with that, have a very healthy day.